Don't forget to like, subscribe and share the videos.
India has highest number of TB cases globally in 2022 according to WHO report. See, it is related to tuberculosis, that is a thing related to disease. So for UPSC exam, it is related to the prelims under general science topic. Similarly, under mains GS paper 3 science and technology, it is related to related to a subtopic called awareness in the field of IT, space, computers, robotics, nanotechnology as well as biotechnology. Okay, let's have a look into the details of the news as well as the analysis in the upcoming slides. The World Health Organization has recently released Global Health TB Report 2023. What it has said is that India accounted for the highest number of TB cases in 2022 globally, and in terms of percentage, India is having nearly 27% of global burden of TB cases in India, and nearly 30 high burden TB countries accounted for nearly 87% of cases. And in 2022 itself, India recorded 2.8 million TB cases, and in that nearly 12% have the fatality, they have been died. And then the multi-drug resistant, which is the public health crisis, has reached nearly 1.1 lakh cases during 2022 in India. And what is the silver lining in this report is that the recovery in terms of the number of persons being affected by TB has increased in 2022 because of their access to the diagnosis in the healthcare system. And the India, Indonesia and Philippines, these three countries accounted for nearly 60% of the overall TB cases across the globe in 2022. So these are all the factual thing that has been brought out by World Health Organization. What it is bringing out is that India is the only country that is having more number of TB when compared to other country. So this is what the details of the news is. Okay, let's have a look into final part of the news, that is, so what it has said is that, see, as I said, even though the magnitude of the people, those who have been affected by the TB has got increased in 2022, at the same time the diagnosis of the people is also got increased during the 2022, and this World Health Organization's global TB monitoring began in 1995, and this year not only this 2 years, that is from 2022, that is the TB incident rate, that is new case recorded per 1 lakh population, in that it has reached 3.9% in the 2020 and 2022 period, which is higher than the 2% of TB incident rate that was prevailing in the previous 2 decades. So this is what the details of the news is about. Okay, let's look into the analysis of the news. First, we will look into what does this TB is about. TB is the bacterial infection, and it spreads through inhaling of tiny droplets from the cough or the sneeze of the infected person, and it mainly affects the lungs and also the other part of the body at later stage of the disease. So there are different types of TBs. First is the pulmonary TB, the TB that affects the lungs, and it only spreads after prolonged exposure to the to other person who is having illness, and it will not show any kind of symptoms. The latent TB is, but this TB will be this TB will be prevented by ourselves only, because of the immunity that is already present inside the human body. The latent TB is sometimes the immune system cannot able to kill the TB bacteria, so that this bacteria could able to manage itself to live inside the human body for longer period of time. So such kind of condition is called as latent TB, and it is not infectious to others, and it will not show any kind of symptoms on the person on whose this kind of TB is present. And the active TB is, see, if after the immune system could not able to kill or reduce the infection of this TB bacteria, it will spread to the all part of the body and it will be having symptoms. Such kind of TB is called as active TB. This latent TB, that is the TB that is present inside the body subtly without any kind of symptoms. After sometimes, when our body gets old and our immunity is getting reduced, during that time this latent TB could itself convert into the active TB. So these are all the different types of TB, and the programs that has been implemented in India to contain the TB is, first and foremost program is National TB Elimination Program, that is to end the TB by 2025, and it is being implemented through a National Strategic Plan for TB Elimination, that is from 2020 to 2025. Previously a strategy plan has been introduced during 2017, but because of some administrative reasons it has been cancelled and revamped, and the new strategic plan was formed, and it is being implemented to achieve the goal which was set by the National TB Elimination Program. So what is the challenges that is associated with the eradication of TB in India is, first and foremost, lack of proper built primary healthcare sectors across India is acting as one of the hindrance for the eradication of TB in India. Secondly, lack of regulations, or what to say, silos in regulations across the state for private healthcare is also acting as one of the hindrance for the eradication of TB in India. Thirdly, HIV induced TB cases is also getting increased in India. And finally, the malnourishment and poverty that is prevailing across the country is also acting as one of the challenges for eradication of TB in India. So what need to be studied further is, we should know about World Health Organization and its structure, functions, etc., and its objective, and also we should be aware of what are all the bacterial, viral as well as protozoan diseases being caused by the respective microbes, and what is the difference between all the three diseases. Thirdly, you should also be aware of the non-communicable diseases, what are all the different types of non-communicable diseases, and what are all the programs being implemented in India to prevent this non-communicable